this is Dr. P, and I'm here with Robert. Robert is literally minutes out from having undergone bone marrow aspirate cells and PRP injection to his ulnar collateral ligament, which is the Tommy John ligament. Unfortunately, he tore it, or at least partially tore it pretty significantly, throwing a baseball about 90 miles an hour, right? About 10 days ago. And what concerned you the most about this procedure?
Mostly the pain where they were going to harvest it, but...
So you were worried about the bone marrow part?
Yes.
And how'd that go for you?
It went really well, especially because Dr. P, he did it himself, so I felt a lot more comfortable with it.
That's true. I was able to talk you through it. And it's not, having gone through it myself, it's not nearly as bad as people make it out to be. We numb it up really good. Matter of fact, I remember getting my elbow injected. That actually was a little bit more sore than this part. Well, how was the elbow part for you?
It's doing well. Doing well.
Good. And we got a little bit ways to go here, but you're going to kick butt, and we're not going to let you kick any extra points in football yet. We're going to let you get back playing baseballs. Great job, and I'm proud of you.
Thank you.